Welcome, everybody, and thank you for joining us today. My name is Jason Williamson. I'm the Vice President for Oracle for Startups and Oracle for Research. I'm really excited to spend time with you guys today and host this customer spotlight. And I get a chance to actually do this with one of my favorite customers, which is HEARTio. Being able to be engaged with the startups around the world is super inspiring. It's invigorating. I love it. I mean, it's just so much fun to be able to see and participate in the startup community around the world. But I would say it's even more fulfilling when you get to see startups like HEARTio who are doing things like this for the betterment of the human condition. And we'll get to see some more of that as we go in and on what I'm talking about and why I'm so excited. But before we get started, I'd like to share a poll with everyone and see if we can interact together here. Which one of the following is true? So you'll be able to see this and participate, and we'll take a look. According to the CDC, about heart disease in the US symptoms, which of these are symptoms in the US? So I'll give you a little bit of time. You can kind of take a look at that. First is that the heart disease is the leading condition, cause of death. One person dies every 36 seconds. 655,000 Americans die from heart disease. That's 1 in 4 deaths, by the way. And then it costs over $219 billion each year. I'll give you a moment. Well, as we can see, they're all true. They're all true. So today, which is pretty startling, right? So today we're going to talk with HEARTio and how they're really achieving breakthrough digital diagnostics to address this crisis that we have in the United States around heart disease. So before we do that, I want you to take a look at this.
$7 million Americans go to their nearest emergency room each year with chest pain. Determining the origin of this chest pain can take anywhere from 8 hours to 3 days to even weeks.
HEARTio is a digital diagnostic startup that uses the most commonly administered cardiac test, the electrocardiogram, to detect problems with your heart more quickly, more accurately, and at a fraction of the cost.
We pair artificial intelligence with this first test, and then we can quickly determine the origin of chest pain and tell the physician, hey, this patient has disease, you should watch out for them, or this patient might be having anxiety or something else. So my grandfather actually passed away from a chest pain misdiagnosis. And so that got me thinking, if people are making these life and death decisions and they only have a couple of moments to think about what they're doing, then you should be able to provide them with as much information as possible to make sure that they're making the right decision for their patient. I don't think we could have done this without, OCI or NVIDIA, mostly because our solution requires number crunching of millions and millions of data points. And on, a CPU or a local computer that we have, that could take months or weeks of time. But with the GPU, we can shorten this down to maybe taking 8 weeks per training run. And if we have the 8 GPU set up like we do with V100s that OCI provides us, we can have 8 different experiments running at one time, 1 per GPU, so we can really speed up this entire process and uncover what hyperparameters work and what experimentation works and what doesn't more quickly than we would otherwise.
And that was great. I mean, I'm excited to dive in. So please welcome with me Utgers Jain. He's the CEO of HEARTio, and we're really excited to bring the story here to hear from you, Utgers, how you're using AI with EKGs to help clinicians to identify heart disease more quickly, more accurately, saving more lives. Man, thanks for coming and welcome.
Yeah, thank you for having me. And it's a privilege to be here. And I know that I'm one of the first startups for the Spotlight series. So that is an awesome thing.
Yeah, indeed. Hey, so tell me a little bit about your background, because you touched on it in the story a little bit, but how has your career been to get you to this point?
I have undergraduate degrees in neuroscience and applied mathematics. And I was always interested in how the body worked physiologically speaking, and whether or not we could explain this with mathematics and models and things like that. And I have a lot of personal family ties to family members passing away due to cardiac issues. And so one of my projects in my senior year of college was, if we could use ECGs to detect something going wrong. And at the beginning, this was very rudimentary in terms of its performance. It was 40, 50%, which is pretty in line with what current algorithms are about. But through, the combination of me and my co-founders and reaching out to different healthcare partners and things like that, we were able to generate more data, we were able to do more research, able to spend a lot of time on creating a solution that can actually work in a clinical setting.
So let me just double click on that just a little bit. And so we can kind of understanding more about what you're doing. So, HEARTio is obviously bringing this power of deep learning and AI to a clinician. I'm sure they have access to different devices to do this kind of stuff. So why the EKG? Why the ECG? Why is AI especially good on that particular front?
Yeah. So the most important thing when it comes to AI is data. And the ECG is the most widely used cardiac test. And as you can see on the slide here, ECGIO is our flagship product. We use ECGs because they're widely used. They are used in the emergency department. They're used in private clinics. They're used when you go to your family doctor sometimes. And because they're a digital signal, they're not high resolution images or videos, we can use more complex models with them. And so just the availability and the fact that so many people get them and there's so many outcomes, it makes it a really great resource for AI.
So you touched on this a little bit before. So we've heard about senior college project. Now we're seeing application with AI in the real world using OCI. There's a little bit of a gap there, I think. How did those dots? Because the personal side of the story is the interesting stuff behind the startup and why it's doing what it's doing. Fill in some of those gaps on how you got into that field and some of the, maybe if you can expand a little bit on the research history and how we got to where we are. And then I'd love to dive back into this what you're doing.
Yeah. So I actually ended up going for my PhD at the University of Pittsburgh as well. So I'm a PhD candidate right now. And I met one of my co-founders, Adam, and we play racquetball a lot. And so one day after playing racquetball, we went to the local Qdoba on campus, and I was sharing some of my senior project with him. And he said, if you can make this work, this could be a company. And I knew a friend of mine from Mike, from freshman year of college, Mike, and he is actually here answering questions. So you can thank him for that. And he has a rich family history of cardiologists. And so I think this made it a really natural pairing. We were able to, get together, and it kind of took off from there. We were able to see, what's out there, what are the actual issues, what problems can we actually solve, what products can we develop that are actually marketable. And so, that we kind of took off from there.
It's interesting to hear everybody's kind of take on two big things, obviously, right now, which is response to pandemic and response to just kind of this notion of digital transformation. And I love hearing you guys are born in the cloud. How, as from a startup lens, how is being at the intersection of digital transformation with the forces of the pandemic impacted how you guys have done business, how it's helped your growth? How have you leveraged technology to do that? What's your take on that?
Yeah. So like many companies, we've gone completely virtual and remote. I guess this was a great time to fundraise, but what ended up happening was it's really difficult to get people to trust you with their money because you have to make sure that they feel that you're confident in what you're doing. And so it's a lot harder to raise money when you're remote, but I think we've done that pretty successfully so far. In terms of how we are helping during the pandemic, one case study we've done is during the early days of the pandemic, people didn't want to go to the hospital or office visits to see physicians unnecessarily. And so when they were scheduled for surgery, they needed to be cleared on a cardiac basis. And so what we were able to do was take the ECG that comes out of an Apple Watch, transform that into a 12-lead medical grade ECG, have that be reviewed by cardiologists who can then clear them for surgery without the patient ever needing to step foot into an office.
That's actually pretty awesome. So how is OCI, how's the cloud helping you do that? Like where is that happening?
Yeah, so the entire application, what we call ECGIO, is housed on OCI, and the model development is also done completely on OCI. And without OCI, I don't think we would have been able to develop our product this quickly. We needed, multiple GPUs to run different experiments, and the cost-saving measures that OCI has provided us with have been invaluable in getting our product to physicians' hands.
Yeah, you talked about, and we saw a little bit of that in that prior slide, and like how you're using OCI to kind of address the needs of serving people remotely, basically. But you've talked about some, especially people who aren't exposed to data science and machine learning. You've mentioned things like GPUs and things like that. Those are not always easy to acquire, right?
Yeah. Yes.
So for a small company like you, how did Oracle serve you in that manner to get your hands on, NVIDIA chips running on OCI, which is like that's what's enabling you to run millions of machinations of, talk to me about that.
Yeah, so we actually started doing a lot of experimentation on our local computers. We, have pretty girthy computers here, but it's not, anything like a GPU. And these experiments, figure out, how to set up your training run, what data to use in what way, that could take weeks or months of time. And that would really slow down our process, because we would have an idea and we would say, okay, let's evaluate whether this idea works on, a clinical basis, or whether this decision should be made this way, or how should we classify different things. And it would take a month to get feedback. And so, it would the entire cycle of production would take way longer. But with OCI, we're able to get gigantic virtual machines that have up to 8 GPUs, which are V100s. Even the A100s are coming out. So we're able to run, full-fledged training sessions on each GPU, even at the same time. And so we're able to have 6 ideas, run all of them at once. Within a couple of days, we know exactly what works and what doesn't. And, we can really move forward with our production a lot faster. So
we're not like the only cloud provider with GPUs out there, right? Like, why did you pick us? Why do you think we're a good idea?
Yeah, so I think that we were actually transitioning from one cloud provider to OCI. And I think the transition process was made seamless by the tech help team at OCI. We felt like we were, the number one customer. All their questions were answered directly. If we ever had a question, it wouldn't be, a ticket that would last somewhere for 3, 4, or 5 days. It would be, let's get on a Zoom call right now. Let's get this figured out. And so I think that personalization was amazing.
That's good to hear. I mean, as somebody that obviously is trying to serve the startup community, it's really important for us to be able to deliver on that promise. So seeing you guys be able to have a good experience is important. Like, getting compute is at an amazing price for performance, like getting access to these NVIDIA V100s and soon to A's is awesome, and a great opportunity to do through the startup program. Were there any other kind of benefits you felt through? You mentioned the personalized technical support. Like, has there been any other experiences that have been positive for you that other people can kind of hear as a startup in the startup program?
Yeah, I think that just the marketing aspect as well, like obviously this, but just the amount of things that Oracle wants us to do in collaboration is amazing. We get to put our name out there to people that we would never have a chance to otherwise. Yeah. So I think that is definitely a really great benefit.
So let me shift to some successes that you guys have had. Earlier this year, you guys swept the Oracle Startup Idol contest. you took the hearts of the judges, and like all three got accolades in most creative, best overall pitch, most innovative solution. That's not trivial to do. There were 70 judges. Like, what did you say in 3 minutes to do that for everybody?
So I think pitching on its basis is a form of storytelling, and we have to find a story that resonates with the most amount of people. And I think our story was that idea of not really knowing whether something is wrong with you. So for example, if you go to the ER and you have chest pain, it might take anywhere from a couple of hours to days or weeks to figure out whether you actually have cardiac disease as the culprit of that chest pain. So I think that was what we sort of hung our hat on.
That's awesome. So let's talk about kind of how you do it. Like, talk to us about like, how does this work? Like, how are you accomplishing this? Like, we know you're using like massive training data. Talk to me a little bit about how the software works.
Yeah, so we have a deep learning model that's built upon 10 million ECGs and 500,000 patients from a variety of sources. And what happens is, obviously, we're not approved by the FDA now, but in the future, when we are, a nurse or a physician or an ECG tech will have an ECG on a patient that comes in. They will record the ECG. The ECG is sent to the EMR, but before it gets there, we actually divert that data to us in the cloud and OCI. And then we actually generate a report similar to this, where we have the ECG, we have our assessment of this ECG. And the most important thing is for us, the severity of CAD or coronary artery disease, which is buildup of plaque and supplying oxygen to the heart. So what happens is when the reason that people do all these diagnostic tests for someone that walks into the ER is because not figuring out whether that chest pain is because of cardiac disease is very important. If you don't find it quickly or you don't address it quickly, then that could have damaging consequences to your heart.
All right. So the plaque buildup, that's the stuff that's like floating around, and it's when you hear about like blockage, that's what that is, right? Mm-hmm. Okay. So you're saying it's gone from weeks to like, what's that? So say I think I have a heart event.
Yes.
So you're saying I'm going to walk into my local ER and they're going to hook me up on, they're going to put all the things on me, right? And then that data then goes to you guys. So who's the customer here? Is the customer like the provider, the hospitals?
Yeah, so they would be the hospital networks. We actually talk a little about this later, I believe, but we have breakthrough status, and after approval, we'll get 4 years of Medicare coverage. And so if they are a Medicare patient, then the hospital has the incentive to automatically use.
Okay, hold on to that thought, because I want to understand what that means for a second. So so you're saying, so before, like, I go to the hospital, they hook me up. They're like, you didn't have a heart event, but you know what? In 3 weeks, you need to go talk to your cardiologist, and we're going to figure, right? That's the normal path, right? That you just kind of said.
Usually you have some sort of observation period for 12 hours. They do maybe they do another test, maybe they do another couple of tests. And what they're trying to do is stratify your risk, if you're very risky, you'll go right to a coronary angiogram and catheterization. If you're low risk, they'll try to keep you in until they know for a fact that you don't have cardiac disease. But that middle part, that mostly 70% of people are in that middle part where they don't really know what's going on. That's where, they really have to take a lot of time.
So, okay, that's what I want to understand, because, and I'm going to tie this to a story from just recently, but so if I have your models running on this data, what's the time compression look like then? What's that middle period look like?
Yeah, so we can't judge or tell the physicians how to behave, of course, but we're hoping that it would be a much reduced time, and they would not spend, 4 additional tests on a lot of different patients. They will be able to say definitively, hey, this patient actually has disease, put them in the high risk category. This patient has low disease, put them in the low risk category.
Yeah. I mean, literally occurs yesterday. I got a call from a friend of mine, and he had gone to his PCP because he just didn't feel good. Yeah. And they they hooked him up. They did not hook him up. They just did kind of the normal. They did not hook him up, and they literally found him unconscious in the parking lot because he had a massive heart event. And it's hard for me not to think that like being able to look at these indicators would inform, like you said, you're not going to tell a doc what to do, but they're going to be informed differently than they did. Yes, they did hook them up, but they can't, the reads that you're talking about, which take weeks and weeks for them to dive into, maybe can get prevented. So it's really interesting to hear, about how we can kind of catch these things sooner. I mean, who knows in his case, but it's just talks to the point of how important it is for us to think about these really, really short time windows, right? Like sometimes you don't have weeks and weeks, right?
Right. And I think that's the root of the thing we're trying to do is give physicians the right tools that so they can make the right decisions.
So you've done some really cool stuff here, and I do want to touch back on the FDA stuff. So that's coming up. So don't think I'm not going to ask you that. Yeah. But like, talk to me about implementation. Kind of like what's next for you guys, and what's next for this product.
Yeah. So like with all the vaccine news that's going around, we have to prove to the FDA that we are safe and effective, but we also have to prove to physicians who want to use us that we're credible and that we have valid results. So we have a couple of studies that are coming up that answer both of those questions. So we have a pivotal study, which is what's going to go to the FDA that shows, hey, we are safe and effective. We have another study that's going to have a large scale validation to show that, yes, we have credible results.
Okay, that's really cool. So, in Startup Idle, you received breakthrough. You talked about receiving breakthrough designation by the FDA, and you hinted at it. How competitive is it? Like, talk to me about what that means, and then like how competitive it is to receive that.
Yeah. So the breakthrough designation or breakthrough status is given to companies or devices that are trying to solve a life-threatening issue in a novel way. So for us, we are trying to give physicians the ability to understand the coronary status of a patient non-invasively and upon presentation, instead of having a non-invasive radioactive test, such as a PET, or an invasive one, such as the coronary angiogram. So at the first step, they're able to understand whether or not the patient has cardiac disease, and that's why we received breakthrough status.
And so how hard is it to get it?
Yeah. So I think right now there's only around 125 companies or devices that have received breakthrough status over all the different medical arenas. So cardiology, oncology.
That's pretty good.
Yeah.
That's pretty good. What does that mean for you guys, like as a company?
So in terms of the benefits, we get priority review with the FDA. We get to balance the data that we need pre and post approval. We get direct communication with the FDA. So if we have an issue or we have a question about what type of study we want to run, we can send that study directly to the FDA and get sign off from them. Mm-hmm. And additionally, in terms of increasing the rate of adoption, we have 4 years of Medicare coverage. So nationally, if
what does that mean? Yeah, what does that mean?
So the way that health insurance usually works for someone over the age of 65 is that they're on Medicare. And what that means is that the government is the single payer for them when they go to a procedure or they go to a physician or they go to the hospital. They get the hospital or the physician gets paid by Medicare for performing a procedure. So in our case, after the physician or the hospital uses ECGIO, they will get reimbursed by the government through Medicare.
That's awesome. Now, that probably makes fundraising a little easier for you when you got
a little bit. Yeah.
Tell me about like how are you all in Pittsburgh?
So 2 of us are in Pittsburgh, and Michael, who was answering questions in the Q&A, is near Philly.
Near Philly. Okay, so PA.
We're all in Pennsylvania.
You're all in Pennsylvania. That's fantastic. It took a lot of vision, I think, to kind of get this like personal story, get the right people together, bang this thing out, unbelievably get FDA status so fast at a priority level. That's a really gifted team. It's, really great to hear that Oracle is a critical part of giving you access to some compute that's would have maybe been difficult or cost prohibitive otherwise. What's a 5-year vision for you guys? Like, what do you hope to be? And, what does this conversation look like between me and you, in 5 years?
Yeah, I think that the first thing in that 5-year vision is to get approval from the FDA for our first indication, which is coronary artery disease. And going from that, I think we want to transform ourselves to not just be an ECG focused company. We want to be able to provide an entire suite of biosignal analysis algorithms. So there's a lot of other testing that's done to uncover different facets about your heart. So for example, the echocardiogram uses ultrasound to determine, wall motion abnormalities and ejection fraction and things like that. And, just being able to upgrade the tools that physicians currently have in multiple ways is sort of what we're thinking. So we're starting with the ECG, we're upgrading that to allowing physicians to understand the cardiac coronary status of their patient. But there's so many more things that we can be able to do. And I think that's what we're looking forward to.
Yeah, that's awesome. And I'm excited that we'll be a part of that journey for you guys going forward. So that's great. I know I've got a lot of questions that have been continued to kick around in my mind. I do want to give a chance for people in the audience to talk to you and throw some questions out. Let's do another poll though. Which of the following emerging trends in med tech will have the most impact on public health in the next 5 years? Growing adoption into telemedicine, AI to enhance healthcare, 3D printing of medical devices, virtual reality for training, and then biometric devices for wearables. Let's give people a chance here, and then okay. Yeah, this is great. Interesting. Growing adoption of telemedicine. I'm surprised at that one because I'm doing one today. I think the pandemic forced us to do growing adoption. Well, it's interesting that was a 0. But AI to enhance healthcare. I mean, this is what we're hearing about today, and we've seen as other examples in technology where imagery is being used to do diagnosis on our Oracle for Research platform that we're delivering to researchers are giving people that opportunity to use massive amounts of image data with ML and AI training to do those kinds of things. So that's a really exciting area, I think, that we're going to go see. And one other comment too, 3D printing of medical devices. I think that's going to be an interesting field as well. And one that I love about it with the interjection of where OCI and these GPUs is that it takes a lot of compute to design these things, whether it's a device, for servicing or a device that goes in the human body. I have a child with special needs who is in the future, as this develops, a candidate for some internal devices to help her walk. So it is cool to see that, but that's going to take a ton of compute and resources to be able to do that real-time design and all of that. So let's kind of go into some Q&A and see if we have any that we can go there. And then I do have a couple, questions for you. Okay, I appreciate that question there from our Faraz. So kind of while people think about that, one thing, as a founder, what's we could probably do a whole session on this. What's the best part of your job as a founder, both as an entrepreneur and then an entrepreneur who is doing things to better the human condition? So what's the best part of your job?
I think definitely the best part of my job is, you get to choose your own coworkers. And if Michael and Adam were not my best friends going into this, they're definitely my best friends now. And it's very exciting for me to be able to work with them on a daily basis. Beyond that, getting to meet the extraordinary people that I meet on a daily basis as well is spectacular. I never thought that I would be able to meet with, the VPs of hospital networks or VPs of insurance companies or even a VP of Oracle for that matter, so just meeting with extraordinary people is, I think, the best part of my job, because learning from people who've been there and done that and getting to ask them questions and seeing how they think about things, I think that is the best way to learn. And I think an avid learner at my very core.
Yeah. Yeah. I mean, so like you just talked about, you're getting to meet a ton of interesting people. How has the medical community respond? Like cardiologists, man, what are they saying when they get to experience this product?
There's a little joke. If you ask like 10 different cardiologists to assess something, you're going to get 10 different answers, right?
Maybe 11. Yeah.
And I think the medical community as a whole, it's tough for new startups and new medtech devices to break in, because a lot of the philosophies and foundations are very entrenched. So you have to really prove that the thing that you're promoting and doing is more impressive or more useful than the state of the art, which is a difficult proposition to make. And because it's a difficult proposition, people automatically have this innate bias that, since it's so difficult to prove this, that it's not going to work, which is completely, understandable.
Yeah. Yeah. It's a tough one. So that was a deft answer, but what are some results? So you're saying you're getting a mixed bag. You're getting some people that are like, I'm going to stick to these ways. I'm going to wait to see what the jury says. And then you're having some that are embracing new stuff. Yeah. Okay. Yeah. Have you heard any patient stories?
Yeah, I think that we have a couple of case studies where obviously physicians cannot use us to make decisions as of yet, but physicians have used us and just to see how well we match up with the patients that they're trying to do invasive tests on, and we match up pretty well. And I think there was just one case where the physician did not think, or the patient was healthy because he was having recurrent chest pains. And what we said, this patient has low disease. And so the physician cathed him, but the cath resulted in no significant disease. And so that was a little feather in our cap that we were able to show that, cardiac disease was not the reason for his chest pain.
Yeah, that's pretty cool. It'll be fun as more time comes by where you can see like great stories of I'm not dead. That's going to be the best one for you, right? So, what advice do you think you talked about hearing lots of different people and learning, but there are going to be people who are hearing this that are in your, they're trying to do a medical device. They're trying to do a startup. What is your advice to those folks too?
Yeah, I think the number one thing is to be resilient. Do not get discouraged just because one person said something to you. We had a situation where we were doing our pitch in Starbucks, and there was a physician from a hospital nearby who overheard and was like, "You're never going to be able to do this." And, it's not like we don't use it as motivation or we don't see it as like a sort of bad thing that happened to us, but, you're going to get dozens and hundreds of those, whether they say it or not. So you just be resilient and just trust in your product and, have a great team. And I think that is probably the most important thing. If you have people that you can trust, people that you can rely on, people that you work well with, I think that team can accomplish almost anything.
It's funny you said that. It reminds me of something Safra Katz, who's our CEO, said. She said, if everyone tells you you're crazy, you might be up to something, And so, as a founder, that's something you have to embrace with that resilience. So that's great. Well, I really appreciate the work that you're doing. I appreciate that we've had a chance to serve you, and looking forward to continue to enable you to do your important work. I appreciate everybody who is in the audience joining. It's been a great conversation. I can't wait to keep this going, guys. Let's stay connected. You can follow up and learn more. Visit us at oracle.com/events/customer-spotlight. You can get connected to the right team here at Oracle. You can get in a conversation with us here. If you want to learn more about the startup program, you can learn there. And I would love if you would click on our 1 question survey. Those are the best surveys. But on that note, I'm again really grateful for the time that you gave and the audience that were here today. It was fantastic.
Yeah, but it was a pleasure to be here. Thank you for having me.
Yes. All right. Take care. All right.